All right, welcome to When Joshua Speaks, Brains, Brawn, and Life. This is another episode of the rebranding of the original Atlanta Boxing Podcast. Today, we've got a very special guest, Leslie Lake, who is joining us from the National Blood Clot Alliance. This is going to be a very potentially emotional podcast for me. I know Leslie has her story, but I wanted to give you a moment to introduce yourself, and then I'll get into why I've invited you onto the show.
Great. So first of all, thank you for having me. I'm super excited to be here. So I'm Leslie, and I am the volunteer president of the National Blood Clot Alliance, and I am also a blood clot survivor. I had a pulmonary embolism in June of 2018, and like many people, unfortunately, who do survive, was not given much information and found my way to the National Blood Clot Alliance.
Excellent. So, because of the blood clot that you faced, this is going to correlate directly into my wife who passed away. And maybe, Leslie, you can kind of tell us a little bit about your story. I know we talked about it on the phone for a little bit, but I like to hear, your story about how you found out about blood clots, how it impacted you, and then how it affected not just your personal life, but also your family as well.
Sure. So, as I mentioned, I had my blood clot in June of 2018. I live in New York City, and I work in finance. And that evening, I was supposed to be giving a speech to a group of women in the financial industry. And I'd worked on this speech forever, and I was so excited to give this speech. And it was all about taking risk. Women need to take more risk. We need to take more risk investing. And I was going to get the crowd all riled up, and I was super excited about this. And I left my apartment that morning to go to the dry cleaners. And when I was coming back, I was coming up a slight incline, nothing major. And all of a sudden, boom, I could not breathe. And it was literally to the point where I felt like somebody had put their hands around my neck and completely choked off my oxygen supply. And it was so bad that I had to hold on to the side of buildings to prevent myself from collapsing. And your mind starts to go into all kinds of different places, and I thought, I'm having a heart attack. But then I realized I didn't have any chest pain, and so I was like, what is going on? And I finally managed to get myself back to my apartment. And being in New York, nobody actually stopped to ask me how I was doing, but got myself back to my apartment and called my doctor's office. I had actually had the same doctor for almost 20 years, and she had recently retired. And I should have called 911, but in my mind, I thought I was
Yeah.
going to be giving a speech that night.
Yeah.
And I called the doctor's office and said, hey, I'm having a hard time breathing. Can I come in and have somebody look at me? And they said, sorry, you would be considered to be a new patient. We can see you in a couple weeks.
Wow.
And yeah, which was obviously not the answer that I wanted to hear. And again, in my head, I'm thinking I'm going to be giving a speech that night. And I think a lot of people, when they encounter a medical issue like this, sometimes you think, you kind of convince yourself that it's not a big deal. And I was
Right.
trying very hard to convince myself that it was not a big deal, but it was a big deal. I had never
Yeah.
experienced anything like this before. Anyway, so I ended up going to a group where you can make an appointment online and go get like a Z-Pack or something like that. And I went in and I met
And
with a
I'm
nurse.
sorry, this was like a day later, or this was
Oh no,
after
this is the same day.
same
This
day.
is
Okay. All
the
right.
same
All right.
day. So it's playing out in the same day. And I went in and I met with the nurse, and she said, I had my period at that time. I was perimenopausal, and so I had a very heavy period, which is very normal for women at that point in their lives. And she said, look, I'm not really worried about that at all. She goes, but the fact that you're having a hard time breathing, you must go to the emergency room.
Yeah.
And I said to her, who has the shortest wait time? And she gave me the name of a hospital because, again, in my head,
You're
I'm
still going to
thinking
give a
I'm going to,
speech.
right. And I'm like, maybe it's asthma, maybe I'm developing pneumonia. I think I'm going to be giving a speech. And so I went to the emergency room, and for almost 11 hours, I had 3 pelvic exams by 2 different doctors, an emergency room doctor and a gynecologist. I had an ultrasound and was told that I had fibroids, and that was the reason why I was having a hard time breathing.
Wow.
And so they were talking about letting me go home. Um, all of the tests that you can normally have done. So a D dimer, I never had it. That's they're going to come along with an ultrasound and check your legs or, do the D dimer blood test. Like all of these things would have showed that I probably did have a blood clot, but I actually never had any of these tests, which is very common for women, by the way, when they enter an emergency room. So prior to being released, they decided to do a scan of my lungs, thank goodness. And at that point, it was like, when the record goes, that's exactly what happened. And the next thing I knew, I was told I had a blood clot and I was on a gurney and they were rushing me to the ICU.
Yeah.
I'd never spent a night in the hospital before.
Okay.
Here I ended up in the intensive care unit. I was in a hospital room with another woman who was very, very sick, and hooked up to an IV and all of this stuff around me. And I'm on my phone trying to figure out what a blood clot is. Obviously, I did not give my speech that night because I spent my evening in the ICU overnight. And so this was my first introduction to a blood clot. And I can still remember to this day, all these doctors coming in to see the woman who was next to me. And one of the doctors stopping in my bed on the way out. And she said to me, "Do you know why you're here?" Very aggressively. And I said, "Yes, I had a blood clot." And she said, "Oh no, you have many blood clots." And with that, she walked out of my hospital room. So as you can
Wow.
imagine, my anxiety went through
Through the
the
roof.
with that comment.
I can't even begin. So, I mean, I'm just trying to think like, obviously, your life is changing right there before your eyes. I mean, everything is happening all at once. And you're trying to figure out still, can you go to do your speech the same evening? But now you're starting to realize probably that that's not going to happen, right? And especially with somebody coming in and giving you that type of comment, you're still trying to wrap your head around things and everything is happening so fast. I can't even begin to empathize with how that's going to feel for somebody whose life, like I say, is literally going to change right then and there, and the impact of that for you for the rest of your life. So you mentioned a D dimer. So I guess before we go into that real quick, just for education purposes, and a lot of the people who may not be familiar with why we're talking about a blood clot, these symptoms are for a condition called DVT
Correct.
and the risk of something being called PE. So DVT stands for deep vein thrombosis. PE is pulmonary embolism. Can
Correct.
you talk to us a little bit about how you were able to educate yourself on that based on maybe your story or even just the steps moving forward after that night?
Sure. So I think the most important thing is for people to be aware of the signs and symptoms of a blood clot. So for me, I had heard the term before. I had been on hormonal birth control before.
Okay.
The phrase birth control had come up, but it had never really been explained to me what it
Yeah.
was. Even though for hormonal birth control, it is a very big risk for women that needs to be explained much more in depth than it is. And so I didn't have the typical signs and symptoms of deep vein thrombosis, which is that blood clot, typically in your leg or your arm, where your leg swells up, it gets hot, it turns red, it turns blue. There's
Yeah.
discoloration associated with it. I had the pulmonary embolism, which is that piece of the clot that breaks off and travels through those deep veins and ends up in your lungs. And so what I learned was that that's what I had. I had the pulmonary embolism, and I had many blood clots in my lungs.
Right.
And it kills 100,000 people a year. So it's very, very serious. And for 900,000 people a year that also will get a blood clot, a lot of these folks will have long-term health complications. The
Right.
recurrence rate is very high. It's up to 30%, within a 10-year period that you'll actually have another blood clot. So knowing those signs and symptoms, I wish I had known what they were, because perhaps I could have then forced, my opinion on the clinicians to say, "Hey, why are we not
Yeah.
testing for this?" Because they're really easy tests. They're super easy to be done,
Right.
and it was never done for me. We went 11 hours without actually doing those tests, and then went to the CT scan.
So you mentioned some numbers that have come up in my research as well. So I definitely appreciate you sharing that, because I think the data is something that's really important for people to understand. One of the things through my personal research is that there's two sides to this situation. There's the medical world that is prescribing your birth control pills, hormonal birth control pills, right? Oral contraceptives, even as it's described. And the blood test that you're talking about, I think it's called a pharmacogenetic testing, which is to ensure that the estrogen-based contraceptive is right for women. Do you think that, and I don't know, maybe you could tell me, have you had any experience with learning more about that? Or do you feel like more women need to have this blood test? Because like you said, it's a simple test. And just like anything that, any medical condition that you have, when you, male, female, they ask, what kind of medication are you on? And, if you're
Yes.
on birth control, right? Like, okay, so that's a question that's asked, but it's not, to me, it's not, it seems like it's dismissed as, all these cases are very minor, right? Like it's not really that dangerous. I mean, can you maybe talk to that a little bit? Because I feel like when you're using phrases like complications are rare or it's generally safe, the risk is low, are women really aware of what they're putting into their bodies?
Probably not. And I was a prime example of that. I mean, I was on hormonal birth control for a really long time, and I never had an in-depth conversation about it. It was kind of like the equivalent of like, oh, it's sunny out today. And then we moved on to, kind of the next topic. And look, this is a really important conversation for women to have with their doctors. And it should not be dismissed because it should be their decision to decide what it is that they want to do. We get a lot of pushback from clinicians about not doing genetic testing, and we certainly understand that because we don't want to work people up into a frenzy, and not everybody, needs to be tested necessarily, but they need to know what the risks are
Yeah.
associated with hormonal birth control and blood clots in particular. It is not an insignificant amount of people that get blood clots because of hormonal birth control and also hormonal replacement therapy.
Mm,
And so again, testing can be done to help women make decisions, but they need to have that conversation with their clinician. And I would say, don't be dismissed. This is an important topic for you to address, and also for parents who may have young women on hormonal birth control. Make sure that conversation is happening,
yeah.
with your primary care doctor, with your OBGYN doctor. If you're pregnant, and this is, off topic of hormonal birth control or replacement therapy, but pulmonary embolism is one of the leading causes of maternal mortality in
Mm,
this country. And for
mm.
Black women in particular, I think it's the third leading cause of death in the United States. Highly, highly preventable. People should not be dying from this, but they need to be made aware of what the risks are associated with these different birth control, hormone replacement therapy, and pregnancy overall.
I appreciate you saying that, because my wife was a Black woman. She was 45 years old. She was a nutritionist. She was an athlete. She was an advocate for women's health. Her business alone was in regards to teaching women. Her niche, I should say, was educating women 35 and older. Her tagline was how to become healthier, happier, hotter, and to lose 30 pounds in 90 days. Like, she literally taught women who were either too busy or never were trained before, how to eat, how to cook meals and be healthy, because based on her experience, she wasn't a medical doctor anyway. Like, none of us here are medically certified, right? But there's enough research and there's enough passion that we can take in order to want healthy lives for ourselves and for those around us. And the dangers that I'm seeing that she was trying to help these women with, women of color, but women in general, was, if you're taking care of yourself, if you're eating healthier, if you're exercising, you're doing the things that you're supposed to be doing, you can live a healthier, longer life. But here comes something that really impacted our lives very seriously, was the fact that she was on she was taking oral contraceptives from a very young age, right? And even before she and I met, we both decided, one, she had decided a long time ago she didn't want children, right? Totally understandable. I have one son. I didn't want any more by the time we met. So I didn't think of it as a situation at that point in time, like, I need to bring up that contraceptives are dangerous to her lifestyle? No, because I was completely oblivious to something like that. I wanted us to be healthy. I have a boxing background. I have a personal trainer. We both wanted to live healthy lives. We were traveling. So when she was taking these contraceptives, I didn't even think of the fact that, you know what, maybe that is a cause for it. To take it a step further, if I had done a little bit more paying attention, which I know they say, hindsight is foresight, right? Um, with her family having a history of blood clots where they have very thick blood in general, father's side, the mother's side. The mother even now still has some complications due to a blood clot that she had in her leg. Um, this is a very much a risk for women to take something that puts them in a much more dangerous situation. And with the misdiagnosis that's taking place, they say, oh, it's maybe sciatica, or women are having cramps, or it's just a muscle strain. You said something to me that really stood out that's very profound. It's a simple test. It's very preventable. Why do you think that? And this is really what I'd like to ask. Why do you feel, based on your experience and your history, and obviously now being very much involved with the Alliance, why do you think it's so easily misdiagnosed or bypassed when people are having these type of concerns, or they're showing up in the hospital, and it's always, I want to say always, excuse my language, but very common factors, very common symptoms. It's the pain in the leg, it's the chest pain, it's the shortness of breath, like we touched on. Why do you think it's so easily bypassed and misdiagnosed?
Oh, so I mean, this is a great question and kind of gets to the crux of everything.
Yeah,
I can't give you a great answer for this. I mean, I'm going to say a couple of things. One is, if somebody has cancer, you go to an oncologist, right?
right.
If somebody has a heart problem, you go to a cardiologist. If somebody has a blood clot, who owns that space?
Yeah.
I mean, there's no clinician that's quote unquote preventative in terms of educating people. And so there's a lack of kind of assigning it to the right clinicians from the get-go. It's clearly not being taught enough in medical school, like there needs to be more training around this. And as it pertains to women in particular, and I think we all know the what the stats look like, but if a man and a woman present at a hospital with the same blood clot related symptoms, he's much more inclined to be taken seriously than the woman is. And
Mm,
often the woman is, sent home. When the reality of the situation is that men actually get blood clots a little more often than women do, but
mm,
women tend to die from them more than men actually do. And part of that is because, we're just not taken as seriously in a clinical setting, emergency room setting. And we see this over and over with our patient community. And so we need to do a better job of making sure that clinicians treat women appropriately. The fact that your wife had a family history of this, so that is a really it's a huge risk factor.
yeah,
And a doctor should have asked that when
right.
she was prescribed hormonal birth control. There should have been a conversation about, do you have a family history of this? Because that family history is a big risk factor. Like, I would encourage everybody listening to this, at the National Blood Clot Alliance, if you go to stoptheclot.org, we have a section on women's risk factors, and print that out, take a look at that. And, if you check mark some of those things, then that moves you into a higher risk category, in which case maybe you shouldn't be taking the hormonal birth control. And there are
Yeah,
other options. You don't have to take hormonal birth control. There's a new birth control out now called O pill,
yeah.
which
Heard about that
actually
one.
doesn't have hormones. in it. And so at least have the conversation with your clinician about this. And the other comment I want to make is that for the Black community in particular, they have somewhere between a 30 and 60% higher rate of incidence and mortality of blood clots than Caucasians do. And frankly, part of that is genetic, part of it can be attributed to comorbidities, but a lot of it is due to structural racism. And just like women are being discriminated upon, Black individuals are as well. And so this unfortunate shouldering of having to advocate for yourself is a really real thing. I mean, I work completely different with my clinical team now than I did ever before having the blood clot. I'm much more forceful, and unfortunately, that's how we have to be.
Yeah, I think there was something that I read, and I'm afraid of misquoting right now, but there was something that I was reading where when Black women or Black patients in general, but in this case, Black women, when they come into a doctor's office, a lot of times they're easily dismissed because they say, oh, well, she's stronger or she's tougher than a woman who's Caucasian or Asian or Hispanic, right? So it's very dismissive of a whole entire community of people, especially to the women that are really suffering from this situation. I can't speak too much on the numbers of that because I don't really know, right? But I feel like still something that stood out to me is that since the 60s, I think it was something that I read since like 1967, that there was a study done by the Royal College of General Practitioners. They've been finding out and hearing about and seeing the risk of venous thrombosis has been 3 times higher in women who use oral contraceptives compared to non-users. So we're talking about the 60s, and that's really my point of this, right? Like, this is not something that's new, that death and risk has been around for, they've been aware of it for quite some time. And I'm just really struggling with the fact that, okay, so it might not be the same number as, say, cancer patients or HIV patients or something like that. I don't even know what the comparative numbers are, to be quite frankly. But to have a number, you mentioned 100,000 people die every single year. Out of that 100,000, and what I've seen and read is that 300 to 400 women die every year in the United States alone, just due to the choice of taking hormonal contraceptives. And I'm quoting that from something called the public discourse. So reading that alone, it's like, I don't care what is going through a medical doctor's mind. A lot of these symptoms are very similar. How can we create more awareness? Obviously, what we're doing right now and having these conversations are great fundamental resources, I think. But at the same point in time, how can we really create more awareness for those who are in a position in a medical field? Your clinicians, your physicians, your doctors, your hematologists. What can we do? Because obviously that's part of the mission and the vision that we have when we're putting something together like this, right? So what do you suggest? What are your recommendations? What have you heard even from professionals that maybe you've come into contact with to help create that awareness?
Yeah, so another great question. So there's multiple pieces to this as well.
I
Uh,
know. I'm sorry for not preparing you for these deep questions.
no. I think this is fantastic. And look, this is part of how we're actually reaching people, right? So a couple of things. One is, who do you interact with the majority of time when you go to the doctor? Probably your PCP, your family doctor. And so
Right.
making sure that they are educated, that they're made aware of the risk of blood clots. And so really reaching that group of individuals, I think, is key. Family planning, OBGYN, making sure that those folks are reached as well. And then I'll tell you, in the case of blood clots, even though this is a public health crisis, that 100,000 number that I gave you and the 900,000 number that I gave you, those are estimates. And the reason
Mm.
why those are estimates is because in this country, as opposed to the UK and other places, there's no national surveillance system in place to actually track what the numbers truly are. So
Oh, man.
we're making assumptions, nor is there any dedicated funding, federal funding for blood clot education and awareness. in this country the way there is for other diseases and disorders. And so if you really want to join forces and reach the masses, you got to go to the politicians, because we need to change policy. They need to start, giving money so that we can start reaching the public by the millions and make them educated the way that, cancer has done, HIV/AIDS has done, cardiology has done, all of these different disease states. But you can't do that if you don't have any money.
Yeah.
And there's zero money dedicated to the space. This is a health equity issue
Mm,
as well. And so making sure that we're working and partnering with other health equity organizations is really important. So unfortunately, it is a very multi-pronged process. But the fact that at the highest level, I don't know if you know this, but our president had a blood clot. He had a pulmonary embolism.
yeah.
Never discussed.
Yeah.
I just randomly found that when I was like reading something one time. And so we need to make sure that, National Blood Clot Alliance, every March we go to DC for Blood Clot Awareness Month. And we
Okay.
love to have as many people as possible come with us, because we need people in their own individual states and locations to be educating people.
I'm going
Thank
next year.
you. Thank you. And if people are interested, we've actually started an institute where we can train people on
Oh,
the message about blood clots. And so I'll send you all the information about it, because I'd
please,
love to
please
have you
do.
involved and you can share it with people. But, we really need to organize ourselves. This is the first time ever that we actually had Congress come back to us and say, um, what is the cost to develop a public awareness campaign? It's never been uttered before. Nobody has ever had a conversation about it. And so we're now on the radar screen of Congress, but we need that funding so
Excellent.
that we can start reaching the public. Once upon a time, there was something called Stop the Clot, Spread the Word, which was a campaign that we worked on with the CDC that was incredibly successful. But again, no funding, so couldn't continue it.
So that's great information, right? I think that I'm not huge into politics, and I will definitely say that blood clots are going to impact anybody, no matter if you're red or blue, right? Um, those type of efforts made from the ground really make a change, in my opinion. I'm a strong advocate for putting boots to the ground and making the effort on that level, right? Because if you're waiting for something to happen, it never really comes around. Um, Maybe you could tell me, like, first of all, how long have you been with the NBCA now? And then during that time, what progress have you potentially seen that has been made for everyday people? And then who has been a part of that? Because obviously, with this having an athletic piece to this, something I want to touch on also is some of the famous athletes that you have maybe heard about, come into contact with, but not even just the athletes, right? Like who's been a part and contributed to the alliance, to kind of show from the time you've joined or the time the alliance has really kicked this off, the progress that has been made over in the last few years or
Yeah.
decade for that matter.
So another great question. So the National Blood Clot Alliance actually was founded in 2003, if you can believe it. I had my blood clot in June of 2018. And as I mentioned, I I left the hospital with no information whatsoever. It was like, see ya, you're leaving the ICU. You have no idea what has happened to you. I was asked, two questions before I was released. And I went home and got on Google. And of course, all the doctors hate when you do that. But you know what? If you don't have any information, you're left to your own devices to get information. So anybody who has this that leaves the hospital should be given information. Like
Right.
they should all have National Blood Clot Alliance information. That's what I ended. Thank God I found them and I ended up on their website, and then I contacted them. I got a ton of information. I remember my first doctor's appointment pre NBCA, where I was like the proverbial, deer in the headlights, like had no clue what was going on. And like I worried about my business. I was like, can I run my business anymore? Like I had all these health issues and I didn't know what the long-term complications were going to be about this. I'd never been to a therapist before. I needed to find a therapist because mentally I was really struggling with this.
That's a
And
key
then
point.
Yeah, and it's interesting because we did a survey called the Flu Survey on this, and we had 3,300 patients take the survey talking about their PTSD related to blood clots, and approximately 97% of people said they still suffered from some form of PTSD, no matter how long ago they had their blood clot. I'm one of those people. I get on an airplane, I fly a lot for work. I still have, those issues that I might get a blood clot. So
Yeah.
finding them was a game changer for me. My second doctor's appointment, I went in and I was like, I want to know, boom, 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 give me this information. My first hematologist I actually fired because I didn't feel as though he was, supportive of me, and he was late getting back to me, and he really wasn't, like, I don't know,
Dismissive.
he was a little bit dismissive, and I was like, you know what, this doesn't work for me.
Yeah.
And I changed hospitals because I was given the wrong protocol, because I'm what's called unprovoked, and I should be on an anticoagulant probably forever. So I changed hospitals. So don't be afraid to make those changes.
Right.
You're the captain of your own team.
Right.
Uh, Sports analogy here, and they all work for us. So make sure you have a team that you feel good about, that is supporting you. In terms of people that I've met and some of the things that we're doing, so you very eloquently said, boots on the ground, and so we developed a program called Thrombassadors.
Yeah.
And so it's a play on ambassador and thrombosis, which is blood clots. We call them
I like
thrombassadors.
that. Hashtag
And
Ambassador.
exactly. There's nothing more powerful than boots on the ground. And so we have a network of people. They can either be patients, they can be family members that have been impacted, lost a loved one, or loved ones had a blood clot. It could be a clinician, or just a concerned, citizen that wants to share awareness. And they go into their local communities and they educate people about blood clots. And so it could be going to a school, it could be going to a firehouse, it could be going to a whole, hosting a health fair, that kind of stuff. That has spread across the country. And those same people, and these are everyday heroes, right? It's
Yeah.
not like a big name person. These are everyday heroes that are volunteering, that are taking their time to spread awareness. And they're also targeting their local government officials. And that is all bubbling up because now that it has gone across the country, that is how we actually organized ourselves to go into DC. So this was our second year going. Next year will be our third.
Awesome.
And we've made great progress getting in front of a ton of members of Congress, who we've actually found a couple of members that have had blood clots themselves. Surprise, surprise. And so that grassroots initiative has really bubbled up to the federal level. And
Yeah.
we're seeing just a huge, huge impact in raising awareness. And
That's
then,
Go
sorry,
ahead.
go
I'm
ahead.
sorry. No, please do.
Yeah, you were asking about other people, that have been accreted to the process. So I know we talked about this before, but our official ambassador is a woman by the name of Katie Hoff, and Katie is a multi-time Olympian world record holder swimmer, and she was dubbed the female Michael Phelps. I mean, she was so dominant in competitive swimming, and she developed pulmonary embolism.
Mm,
She did 7 weeks while she was in Olympic trials. Now, here's a person who is at, like, I can't even imagine being that elite of an athlete
yeah.
who has unbelievable clinical resources at her fingertips. They
Yeah.
they missed her blood clot. She went 7 weeks flying around the country with a blood clot. I mean, it's amazing she's still alive.
Absolutely.
Probably, part of it is because she was in such elite shape.
Yeah.
Um, but her career ended because she had damage done to her lungs. So she is out there as a very public figure, raising awareness about blood clots. And actually, she is in Paris soon because she's going to be reporting for Yahoo Sports
Okay.
on swimming, and she's actually going to be tuning into NBC to give an update on the Olympics. And there's actually quite a few athletes that are participating at the Olympics that are blood clot survivors. Somebody else that a lot of folks don't know about is Trey Smith, who's from Tennessee, and he is on the Kansas City Chiefs. Um,
Okay.
yeah, and he is a two-time Super Bowl champion, and he also is a pulmonary embolism survivor. We actually have a great interview of Katie and Trey, and so he also has been, um, a big proponent of trying to raise awareness about blood clots. But there's a whole host of athletes from, Chris Bosh to Deion Sanders to, arguably one of the greatest athletes of all time, which is Serena Williams. She's had
Absolutely.
two pulmonary embolism, one during childbirth, and she was completely, I was talking to her husband about this, and she was completely dismissed by the nurse and, was told, oh no, this is normal. This is a normal reaction to childbirth. And she was like, no, this is not normal. I can't breathe.
Right.
And so she demanded the CT scan, and sure enough, she was completely right that she had a blood clot. Um, but I can tell you some of the folks that are actually attending the Olympics, if you'd like to hear,
Y-
that have had blood clots. So
Yeah.
Nelly Korda, I don't know if you know Nelly Korda. She's the #1 ranked female golfer in the world. She had a blood clot in March of 2022.
Wow.
Kristen Faulkner, May of 2023. She's a cycling Olympic athlete. She had a pulmonary embolism. We have Maddie Wanamaker, who is a rower. Again, she also had a blood clot. And then Jacob Dawson, also rowing, had a blood clot. Ryan Krauser, I don't know if you know who Ryan is, but he is a medalist, world record holder in U.S. shot put.
Okay.
And he's competing, and he had a blood clot last year, actually, and still managed to win the, I think, world championship in shot put. And these are just a few of the people, but we actually have athletes competing this year that have had blood clots.
And that's the thing that I really think that brings a lot of this into perspective, right? So blood clots are not your typical condition that impact people, even though there are higher risk for people who aren't active
Mhm.
or who aren't health buffs, for lack of a better term, right? Or are not into personal fitness. You have professional athletes, right? Well-known athletes. You went down a list of Olympic medalists. You went down a list of NFL athletes, pro tennis players, NBA players. When you have that type of condition and you have this type of awareness trying to be built around people who've suffered from this condition, it just kind of brings me back to another point that we already made earlier, is about the awareness of it and how it's being dismissed. You mentioned how Serena Williams, it was dismissed from the first time she went in, and people who have surgery or women who are giving birth or whatever the case is, that of course puts them a little bit in a higher risk, because obviously, there's a blood component to that that's being impacted by a traumatic what am I trying to say? A traumatic damage that's being put to your body, either
Traumatic
surgery.
event. Yep.
Right. So I look at it like, how is it that could even be possible that it's not, and it's been around for quite some time, as we've already confirmed. How is it that it's not possible that there isn't more that's being done? So I don't want to kind of like, beat that into the ground so much, because I can get really passionate. For me, I'd like to express a little bit with how, with my wife, she dealt with something that she didn't know what it was. And mind you, as aware as she was of her body, as aware of she wasn't, because she actually even mentioned when she was having pain, she says, I think I have a blood clot.
Ugh.
And that sticks here in my mind so often, that we were traveling. We're actually living abroad, and we were in Costa Rica. And so similar to your situation where you were like, I've got a speech tonight. We had plans for the weekend that were coming up. We were going to go see some really close friends that were on the other side of the country. And we hadn't seen them in quite some time. And we were really excited to seeing them. The week before, she was telling me how she feels like her calves are sore.
Mm.
And Is it because of the workout that she had been doing? We were going to the same gym. I was training some locals there with boxing, and she was doing the fitness aspect of it as a personal trainer. And it, she had really taken a little bit of time away from her regular routine, and then she started to jump back into it again from a physical aspect. She asked me one day, "Can you massage my calves?" And I'm like, "Yeah, sure, of course." Massage your calf muscles. She says, "Okay, that kind of helped." But then the chest pains come in. And then she has shortness of breath. She's like, "I'm tired."
Mm-hmm.
Another thing that I learned that I really wish I had been more aware of is the fact that it has, and when you mentioned PTSD, it made me think the psychological impact that it has. My wife was really confident in what she knew, and she came to me, and her name is Tasha. Tasha says, "Why is it that I'm feeling like I'm not really confident in what I'm about to do?" She's about to launch a new program for her clients, a new menu for them to learn, a new participative program that everybody's going to get involved with. And she knew her stuff. She knew her stuff. I wasn't used to her not having that level of confidence in herself. Is there is there more of a mental aspect? Like, I read somewhere there's a condition that maybe there's forms of depression, maybe there's a mental exhaustion that starts to take place during that time because of the blood clots. Have you heard more about that? Is there more research that you've come into
I mean,
contact with?
this is a really interesting topic. So, two things. One is a lot of patients who have had a blood clot will say they had this feeling of anxiety or impending doom. And this is not made up stuff.
Yeah.
We have a podcast at NBC, and we had a gentleman on recently, Dr. Mark Lewis, and he's an oncologist, and he had a pulmonary embolism related to his cancer diagnosis. And he said, I had always heard about this anxiety slash impending doom feeling that people had prior to their blood clot, or while this was all happening. He goes, I experienced it firsthand. I actually know um, that it actually exists. So, you know, trust your body, trust your mind. If something doesn't feel right, go get it checked out. The other
Yeah.
thing, and this is actually quite groundbreaking, there is new data that has come out from a hematologist in Boston by the name of Dr. Rachel Rosofsky. She's at Mass General Hospital, and she has just published data on this very topic, uh,
Okay.
that anxiety um, can be clot provoking. And so I don't have enough information to um, be eloquent to speak on the topic, but
No, no, no. But this is good information.
there is a correlation between the mental side and the physical side of the equation, and not for everybody, but for some people. And the other thing I would say is that for people who do experience a blood clot, having PTSD is so common. Like, don't dismiss it. Don't feel bad about it. I work on Wall Street, and I worked on Wall Street or still do, but I worked on Wall Street for a very long time. And I was always like, I'm the toughest kid on the block mentality, you
The New
know,
Yorker, the New Yorker was
the
there,
New Yorker.
right? Yeah.
Exactly. You know what? This kicked my butt, and I was afraid of so many things, and it really took a long time for me to get my mojo back. Now I'm now back to I'll kick your butt type of thing, as a New Yorker. But it took a long time, and it took a long time for me to educate myself about this, because we're not viewed as a disease necessarily, we're viewed as a disorder. And so getting information, it's like all over the place, versus what we talked about before: cancer, cardiovascular, diabetes. Like, you know what it is.
Yeah.
Blood
Yeah.
clots are different.
That again, that's good information. And in no way, like I say, was I expecting us to come from the perspective of being medical advisors or experts or anything like that. These are personal stories. These are passions that we share, you and I, Leslie, for the fact that we want to create the awareness for other people who may not be aware of it, or even for the people who have suffered from it, right? Like, to me, to be honest, like having these discussions is kind of a form of therapy because I have someone who I can relate to. You've gone through that story. I haven't had a blood clot personally, but having the love of my life, losing her to a blood clot, it really will have a form of, I call it a form of PTSD
It
because
is.
she literally passed in my arms. So as I get a little bit emotional about it, um, I want people to be aware because they need to prevent this. Um, I plead to medical professionals. I plead to, as you mentioned, people in Congress who can make a difference. I implore your awareness and your heart as a human being to make a change for the betterment of people because even if one person dies, two people die, death is death,
Yes.
you know? And for somebody to survive it, I want to just say I applaud you that um I don't know you personally. This is the literally the first time we've started to interact or anything like that. But I applaud you for the awareness that you're creating. I applaud, the efforts of the association for what they're doing. I don't know the politics of all the things. I don't know the full story behind it. All I know is the educational material that's being put out there has been helpful to me. And I wanted to take some time to really share this for people who would listen, for the athletes that are listening, for the boxers who listen, for the professionals who love basketball or Olympic trials, Olympic sports, excuse me, whoever it is that's out there, I really appreciate you taking some time to do this. Would you be kind enough to share some of the media outlets and the contact information that people can say, I maybe they know somebody who's dealing with it right now, or maybe they're dealing with a death in their family, or maybe they might feel like they have a shortness in breath and their calves hurt. Like, where can they go to get a little bit more education? And then what steps do you feel like that they should take from that point?
Yeah. So the first thing is obviously, if anybody thinks they're having a blood clot, they should either call 911 or immediately go to the hospital and be forceful.
Yeah.
Um, that's number one because you got to get treated. The second thing is if you go to stoptheclot.org, there's all kinds of information on the website. It's free. We don't charge for anything. Never have, never will, because this needs to be out into the public domain. Like I told you before, that was like my go-to resource. Thank God that I found after my blood clot because I was really foundering. Everything is there about signs and symptoms. Everything is there about hormonal birth control. We have a sports and wellness institute that we started a few years back because what we were seeing is that a lot of athletes, not just, I mean, okay, we talk about the big name
Yeah.
athletes. The reality of the situation is that there are a lot more amateur athletes, right?
Yep.
That are out there. And a lot of these folks would get dismissed in the clinical setting because there's this misconception that this only happens to old people.
Yeah.
So not true. Like you said before, it does not matter what color you are, doesn't matter how old you are, it doesn't matter if you're male or female.
Right.
Everybody is at potential risk. And if you have a family history in particular, you're at much higher risk. So you need to learn what the signs and symptoms are. You need to learn if you're in a higher risk category. You need to learn the implication of hormonal birth control. Go to the website. There's unlimited resources. If you have any questions, reach out to info@stoptheclot.org. I'm L Lake at stoptheclot.org. And, for me, I'll be honest with you, once I started to get my arms around what had happened and I started to learn more about this, I got angry
Yeah.
because this should not be happening to people. It is hugely preventable,
Yeah.
hugely preventable. And I don't want what happened to me or what happened to your wife to be happening to other people. And so,
Absolutely.
we all need to be working together in many, many different ways to try to raise awareness so that, we can stop people from dying from this because it just shouldn't be happening. So, thank you. Put it back on you. I mean, you've taken the most horrific thing that could ever happen and you're using it to try to help and save other people. So thank you for doing your part, because what you're doing is significantly braver than what I've done, because I'm alive.
I completely agree. You're most welcome. I mean, I feel like I could have this conversation with you throughout the rest of the day, right? And I know we have, things that we take care of on a daily basis outside of this, but one thing that I will say is that you mentioned the anger. The anger is still there, but I think what outweighs the anger is the fact that I loved her so much that I want to really do this, right? Like, I mean, obviously you have a love for yourself, you have a love for the others who've come in to this space. And, you know, the anger is like a fuel,
Hmm.
right? It's very much a fuel that keeps that fire burning, but also it's the love and the compassion of wanting to share this with people and do this in a constructive way, because I think it's very easy. And again, maybe this is, another topic for another day, but the mental aspect of that emotion,
Yeah.
because it's so preventable, it's easy to get angry at medical professionals or nurses or other people or anyone for that matter that could prevent this. So again, this is more of an active uh, procedure or an active process that I'm using and we're using to create more education to people to help them stay alive. And there's nothing more important than human life. So I don't care what the politics are. I don't care what the personal beliefs are, the religious beliefs are. Let's stay alive, right?
Yes. Let's protect people. And we have the capability to do it.
Absolutely. Leslie, I'm going to thank you a million times over again.
You're welcome
Um,
anytime.
Yeah, then I hope that maybe we can do this again at another time in the near future. Remember, everybody, that Leslie is also advocating for us to go to Congress in March. That's something that maybe if you guys are really passionate about what this topic was today, I also want to remind all you athletes and family members of athletes that are living well, are very healthy, are very strong, are very young, that this can still impact you and it can impact them, whoever you're close to. But at the end of the day, people like Leslie and the National Blood Clot Alliance are really trying to make awareness that, to watch for the signs and symptoms. So again, I thank you very much for your time today, Leslie. And I look forward to speaking to you again sometime. And hopefully we can talk about maybe some more progressive and positive notes on what we've done today.
Absolutely. And I would say for those that are listening who can't make it to DC in March, there are many other things that you can do, right from your home. So don't be afraid to reach out. This really is a grassroots effort, and we need everybody on deck.
Right on. Thanks, everyone. This has been When Joshua Speaks, Brains, Brawn, and Life. Again, our guest today has been Leslie Lake with the National Blood Clot Alliance. We thank you for your time and be looking out for the next episode to come out to you very soon. Thank you so much.
Thank you.